One of the great things that I think happened, that happened to me as a nurse was about 5 years ago. I was managing a unit over at Shands, AGH, and I got a call and they said, there's a patient down here on our day stay unit wanting to know if Rhea Broyles still works here. And I said, well, yeah, I do. And they said, well, you took care of him about 20 years ago. And I went, wow, and he remembers me? And they said, yes, and he would really like to see you before he goes in for his procedure. And I said, okay. So I went down to see him, and what this gentleman wanted was to tell me how much it meant to him 20 years ago when he was in the hospital for the first time, facing emergency surgery for an orthopedic problem. And he was hungry. He hadn't eaten all day, and he had broken his arm and was having surgery. And he was starving, and that was the biggest thing. And I had promised him a turkey sandwich when he got back to the floor from the PACU. And he said that when he got back, there I was with his turkey sandwich, and he's never forgotten it, and he wanted to thank me. And the thing that really got to me was that this gentleman was facing a lung biopsy for lung cancer. And all he wanted to do was thank me for his turkey sandwich.
I have many fond memories, but one that readily comes to mind is about multiple generations. I was walking in the hall and a lady called my name. She said, Vancia. She asked, are you still here? Do you remember me? She explained I was her nurse when she delivered her first baby girl. I was a nurse when her first baby girl delivered her first baby girl. And now that baby had just delivered her first baby. Wow, I thought, 3 generations, and I am still here, and I was a part of it all.
Well, I think one of the memories that I have working here was earlier on in my career when I used to be responsible for nursing education. And we found that there were 2 nurses that came to start working here that had very little money and were sleeping in their car. They were homeless, and they thought so much of Shands that they drove long way and moved here and stayed in their car. So when we found that out, there was a huge outpouring from the staff on caring for those 2 nurses. So people provided them room and board and gave them a place to stay and really welcomed them into their homes until, you know, they got enough money to be able to purchase or get an apartment. I think that Shands demonstrates its caring to patients every day, but it's really nice to see that they are also vested in their employees.
My fondest memory working here is mostly working with the geriatric patient, the older patient that we have, because I like geriatrics. And but we had this one patient. He was kind of in between geriatrics, but he was we'll call him Mr. J. And he would when he got up where he could go downstairs, you'd find him a wheelchair, and that's when we had TCBY. And he would go down to TCBY. He couldn't hardly breathe, but he would lean over the counter and he would get ice cream, but he wouldn't have any money. So, but then they would look at his armband and find out where he's from. Then they would call us, and he had a tab at TCBY, and we'd go down and pay for it.
I've just always liked the camaraderie, the family atmosphere. We treat everybody so nicely. Everybody is nice to each other. It's like a family, and I think that's what's kept me here.
UF Health Shands is a dynamic workplace. We are in constant pursuit of excellence. I get great pride in working for an organization where patients are the focus and get immense satisfaction knowing I've helped someone who truly needs and appreciates it. I am privileged to contribute to the health and wellness of my patients in a stimulating work environment. The OBGYN population is a challenging population that allows me to maximize my expertise and leadership. My goal is to provide the best of care to our patients and families. I'm never bored at UF Health. The bar of excellence continue to rise higher and higher.
Well, I think that this organization and its mission is what keeps me here. Their mission for science, for evidence-based practice, their mission to continue to research and find better ways to care for patients. But I also think that it's the organization's caring for patients that also have me stay here. So in a combination of all those pieces has given me a place to work that I flourish, that I really enjoy, and I can't think of working anywhere else.
I've been here at UF Health for 35 years, and I keep coming because I like the people I work with, the learning experience, and the patients that I work with, and seeing them getting well and going home.